So we're here to talk about microneedling. Microneedling is a great procedure for boosting your skin's natural collagen and elastin production to plump out fine lines and wrinkles and keep the skin looking youthful. It can also help with acne scarring and texture. Microneedling creates micro injuries into the skin to allow for the skin to produce its new collagen. They are performed in a precise and a safe manner. Microneedling treatment is usually performed between 30 to 60 minutes, depending on the area of the body. Side effects with the microneedling treatment, typically your skin is a little red afterwards, kind of like you've got sunburn, looks and feels like a sunburn. You can have a little bit of bleeding with the procedure as well. The redness typically resolves within 24 to 48 hours. After about 3 days, your skin is pretty much back to normal as it was before the treatment. Contraindications for the microneedling treatment would be pregnant nursing women, any active acne, sunburn, windburn. Also, you have to stop any retinols or exfoliating acids a few days prior to the treatment. Also, keloid scarring and scleroderma. Also cannot be done within 1 year of using Accutane. No waxing 2 weeks before or after the treatment as well. So what to expect after a microneedling treatment? Obviously your skin is going to be pretty red for the first day. That redness pretty much cuts in half just about the day after that. By day 3, the redness is pretty much gone. You can get a little bit of sloughing or peeling of the skin about day 2 or 3 afterwards. This doesn't always happen, but it is just aiding in that cell turnover process. You can feel a little dry, a little itchy while the skin is healing, and we do give you aftercare to kind of combat these things. So what to expect before your microneedling treatment? We like for you to come with clean skin, no makeup or sunscreen. Just allows for more time during the treatment. A few other things to keep in mind before treatment are to stop any retinols or exfoliating acids about a week before. Also, we cannot microneedle over any active acne, active lesions, sunburn, windburn skin. Also have to be off of Accutane within a year. No waxing about 2 weeks before the treatment as well. If you are prone to keloid scarring, the treatment may not be right for you. If you are pregnant or nursing, we will have to wait until after you are finished. Also, we cannot treat active cold sores, but we can send a prescription to prevent any cold sores if you are prone to them. So now we'll talk a little bit about aftercare after your treatment. So when you come in for a microneedling, we use the Skin Pen microneedling device, which comes with some lovely aftercare. Very simple, very easy. For the first 3 days, you will not use any of your normal skincare products except a gentle cleanser and these 2 goodies right here. We have Lift and Rescue. Lift is going to be the one that you use right after your treatment and that night before bed. You can apply it as many times as you need just to keep the skin protected and hydrated. And then the next day you start Rescue. This is going to be your best friend for the next 3 days after your treatment. So you'll use it for 3 days, morning, middle of the day, and night. Whenever you feel like your skin needs that little extra boost of hydration, this is just really going to help to calm the skin after your treatment. After day 3, you can then return to using your normal skincare routine with your moisturizers and serums, but you still want to keep in mind not to use any exfoliating products or retinols for about a week after the treatment. Also, very important after your microneedling to not put on any makeup or sunscreen for 24 hours. You can wear makeup and sunscreen 24 hours after the treatment if you need to cover any residual redness. We would prefer you to not wear makeup if you don't have to, just while the skin is healing, but is absolutely okay after the 24-hour mark. With microneedling, you do have to be a little extra cautious after the treatment because we are creating those injuries into the skin, so we don't want to increase the risk of bacteria or infection entering into the dermis. So no sweating or nothing that's going to make you perspirate, swimming, or exercising for about 48 hours after your treatment.